everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Welcome to our regular Q&A Mondays. This is the place where I answer your direct and specific questions that you have for me. So if you do have questions and you're watching, please comment below, or you can email them to me. My email is in the bio part of this channel. As always, I selected 6 random questions. I blocked out everybody's identity for privacy reasons. So we're going to go over those questions today. Keep in mind, there is a timestamps below in case if you want to jump through the questions and see what they're all about, as well as, let's see, I'm trying to think if there's any other housekeeping that I need to address, but I think that's pretty much. Oh, and make sure your questions, if you're planning to pose them to me, are not diagnostic in nature. I just can't answer that without working with you. But as long as they're general, I'm able to generalize them to everybody else. So let's get started. Question, disclosure. Should I or shouldn't I disclose? Example, I am trans, or remain stealth and hope not to be outed. I know you've done this topic in the past, but it seems more relevant now due to the political climate and the I didn't know you were trans defense that many of the perpetrators use to get out of any kind of legal responsibility for killing you for being trans. Dark question, but so relevant and valid and to pertaining to today's times and what's going on in today's world. I did do a video about this, and I did a video specifically about dating and disclosure, where I said that, in my opinion, it is up to you to decide whether you want to disclose or not. I also cautioned that while it is up to you, I personally suggest to disclose because for the reasons you're pointing out in these questions, especially when it comes to dating, intimacy, sexual contact. There has been, as you know, accounts where a person did not disclose and the other party found out and just went berserk on that individual. And the reason why people go berserk is because people get triggered. People are carrying very strong transphobic views, very strong homophobic views. They're having a lot of complexes that are unresolved. And when it gets triggered, in that instance, they may feel like they're over-identifying with that complex. It's not an excuse, never an excuse for behavior. There's never, in my opinion, ever an excuse for violent behavior, just to clarify. So, as I said in that video, I think it's better to disclose. But let me break this question a little bit into 2 different categories. On one hand, if you are dating, if you are getting into intimate relationships, if you're getting into a sexual relationship, I still suggest and recommend disclosure because, one, you're preventing yourself from a person going berserk in the future. 2, you are also immediately have an opportunity to know where that person stands and withdraw your energy and take that energy elsewhere versus investing your energy in this person only to find out that this person is deeply transphobic and is not for you. Those are the 2 main reasons where I suggest disclosure to happen. Now, that disclosure in intimate relationships, in your daily lives, disclosure is completely up to you. And I think oftentimes, unless you are talking to people you know, or you're getting to know somebody and you want to share your transgender history, otherwise, I don't see the point in disclosing. You don't need to be a walking advocate or walking transparency board for your gender. None of us are. I don't walk around and disclose that I'm cisgender. I understand big difference. I understand that my gender is taken deeply for granted. So think about it. Intimacy and dating, I suggest disclosure, but that's just my opinion. All of you have right to disclose or not disclose. That's a personal, private decision. In terms of everyday life, I personally don't think who gives a shit? It's your life. It's personal. And you have to decide when that personal part of your past needs to be shared. So that's where I stand on that question. Hopefully this helps. If you live also in a part of the world where disclosing just to anybody who you are puts you in a dangerous situation outside of intimacy and sexual relationship, then my God, make sure your safety is priority. In that case, do not disclose. In that case, try to be as safe as possible, because today, especially for all of you, safety is a priority like never before. Very, very important to consider. Wishing you all the best. Question number 2. Hi, Dr. Z. I have been watching your videos for approximately 3 years. I think this is fourth year of me making videos. I have to go and check. I'm pretty sure it's been 3 years, but I think we're going on to the fourth year. And find the Q&A sessions immensely informative and enlightening. Thank you. I love making this. I would please like to put a question myself to you. I read many books and social media experiences of people's various translation stories. One thing that seems quite generic is that people seek out a support network. Also, I eventually plucked up the courage to undergo gender identity specific counseling and speak to my GP, who referred me to a gender clinic in 2020, which I reached the top of the list of in August 2022. Wow, I'm so sorry. You live in a country where it took 2 years for you to. Uh, I'm sorry, folks, for everybody watching who have to wait to get care that you need. My heart goes to all of you, which I have kept putting off as it is all too overwhelming and frightening. I am far too shy to speak with or reach out to other transgender people. My question is therefore, how does a shy and socially isolated person navigate the difficult and possibly toxic environment in wider media and society to actually begin to transition both socially and medically? This is a great question. It's a great question because so many of you are going to be struggling with social anxiety. Majority of you are going to be struggling with anxiety regardless. Social anxiety is going to be secondary because when you have dysphoria, you are experiencing that much more discomfort to go out there because guess what? When you go out there, people have to see you, they have to interact with you. And if you're not feeling comfortable with your gender, that's just going to bring up a lot of dysphoria. For that reason, people tend to isolate and withdraw socially and become hermit-like. Um, so when you say you're shy and socially isolated, first I just want to say that you may not be shy and socially isolated, but the dysphoria manifests in this way for you because I have seen a lot of people who once they did transition, they became more extroverted and more social, and it was actually dysphoria. Having said that, if you are shy and tend to socially isolate, how do you navigate this toxic environment? How do you get out there? How do you form social support group? So social support group is not a necessity, but I would say it is very important, especially during these times today. Especially now, a lot of you are incredibly vulnerable to everything that's going on around you because everything that's going on around you has to do with your fundamental human rights and with your dignity as a human being. On top of that, a lot of stuff that's going on threatens your potential existence. So it's akin to you being traumatized on a daily basis in extreme ways. I know that living and existing as a trans person is always traumatizing, but now it's even more than ever before. What I recommend for anybody who's shy or socially isolated is to please not to isolate yourself. It's only going to make things worse for you. It's only going to make you depression and anxiety and everything else you feel worse. When we're isolating, when we are alone, we have nobody else to bear witness to our existence. We have nobody else to bear witness to our story, to our gender. This is why psychotherapy is so powerful, because you have somebody who can bear that witness to who you are. This is also why this channel is so helpful to so many of you, because I bear witness to all of you. I constantly show up and remind all of you, I see you, you exist, you matter. This is why isolation is not good. It's like digging yourself deep into the ground, deep into the darkness, deep into the void. So I know it's hard. Don't necessarily jump out there and go to your local LGBTQ center where there's a lot of people and you suddenly will feel overwhelmed. Little steps. You put this comment today. I guarantee you somebody watching this channel is going to comment, and they're going to comment in response to you. And they're going to give you some suggestions, because that's what everybody has been doing. Everybody has been amazing at giving suggestions and support. So look at the comments. Two, what online community can you start taking steps to belong to? Be careful with online communities too. Find the one that you feel resonates with you. Perhaps instead of necessarily starting to get into the trans community, find community that centers around a focus of a hobby that you enjoy. If you like reading books, book club, online book club. Just a place where you can show up among other people and share your opinion about the book you read. If you like going on hikes, there's groups that meet to go on hikes. I don't know if this is something possible where you live at. I don't know if you live in the United States or other country, but judging by the health scares that you had to wait for, I bet you probably outside of US. Little steps. Find somebody. There's Facebook closed groups that are safe, that are private, that are great, where people are in your shoes, for people that haven't taken steps yet but want to. So I would start reaching out and I would just start seeing which one resonates with you, which one feels positive, which one feels supportive, and join that group. But please don't be isolated. Isolation is just going to make things so much more worse for you. You're also wondering, uh, in terms of toxic environment, minimize your engagement with toxic media, minimize your engagement with accounts where it is negative, 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 negative. Try to stay positive, try to stay optimistic, try to reach out to the content creators who are positive, who are informative, who are helpful. Now, how can you actually begin transition both socially and medically? So, since you're just starting out, sounds like socially perhaps would be the first step. What are the little things you can do socially? You'd be surprised how even tiny step can feel like such a huge achievement and going to make you feel so proud and so much better about yourself and help you with dysphoria. Would a little first steps be finding a group and sharing with them what you're struggling with? Would a very small steps for you would be figuring out what your name is or what your pronouns are and sharing that with somebody? The key to getting out of isolation as a shy and socially isolated person is little small baby steps. With each step, your confidence grows. With each step, you feel more sure. With each step, you feel more affirmed. This is what I would recommend for you. Um, but please don't be isolated. And I gotta say this: if you're watching my channel, which I know you are because you posted a question and you're watching Q&As, and you may be watching other part of my content, you already are connected to me. I am already your supporting anchor. I'm already bearing witness to your story. Now, how can you broaden that to other people and not just myself? So, wish you all the best. Next question, number 3. Dr. Z, as a partner of trans person, thank you so much for your content. You are so welcome. I'm hoping you can give some caregiver tips for after my partner has gender confirmation surgery. Great question. I think this is the first question I actually have from a partner, so it's great to see partners being supportive, getting informed, getting information. So that will depend what type of gender confirmation surgery your partner is having. The reason why I say it depends is because what we typically call top surgeries, facial feminization, facial masculization, breast augmentation, or mastectomy, tend to be a different type of tends to have a different type of recovery period and tend to require a different type of caregivers than people that go through bottom surgery, such as vaginoplasty, phalloplasty, metodioplasty. Those surgeries are bigger and those surgeries have a longer recovery period. If your partner is having any of the top surgeries, for face masculization, facial feminization, in my experience, people usually just want to be left alone. Usually, sometimes people feel very claustrophobic because of the bandages that are covering their head. It's hard for them to eat, depending on the type of procedure they had. They really just need a person knowing that they have somebody there. In case if they want to ask you to, can you bring me blended juice for me to drink, or can you get me a glass of water? So they really just want somebody there. For your partner, I recommend during this time period, get a lot of binge-worthy content to escape into for recovery. For top procedures, breast augmentation or mastectomy, with breast augmentation, usually recovery period is very fast. Um, week or so, usually people can resume their daily activities except for heavy lifting. And the recovery really kind of varies, but it's not big or drastic. It's definitely, in my experience, way minimal than facial feminization or facial masculization. In that instances, you're probably just again going to be there getting them a glass of water, maybe bringing them something, maybe helping them sit up or any one of those things. For individuals who are getting mastectomy, that is for transmasculine removal of breast, if they also have drains put in, um, draining the drains can be quite uncomfortable, quite painful. So for individuals who are going through mastectomy, there could be a little bit more hands-on recovery support you may have to provide. For bottom procedures, if your partner is getting vaginoplasty, you have to be prepared. Bottom procedures, vaginoplasty or phalloplasty, both. I don't know which one your partner is having because you didn't specify your partner's gender identity. For both of those, you need to be very well equipped. The reason why I say this is because there are going to be a lot of things where you might be actually quite hands-on. For vaginoplasty, for example, you may be helping your partner get to the bathroom. You may be, helping them pull down their panties. You may be helping them with their, bandages. You may be seeing blood coming out. You may be seeing things that you need to be prepared to see, that you are going to see potentially wounds. You're going to see things that may look on the surface to you just startling. So it's important to be prepared, what you may witness, what might happen. For that reason, I highly recommend, regarding a procedure, but especially with bottom procedure, to make sure you ask the doctor as a caregiver, what do I need to know about, what do I need to watch out for, what kind of signs do I need to watch out for to notify you that maybe something doesn't look right. Phalloplasty is the same thing. For phalloplasty, there's a long recovery period. Phalloplasty usually 2 or 3-stage procedure, and each stage there's a prolonged period of time in between stages as well. But for the initial stage, a person is also may need you to help them get up, move around a little bit. So be prepared for those procedures. I always say that for partners, it's important to have an understanding what they may be witnessing, be conscientious of their own squeamishness potentially around blood or around things that look like they just gone through the surgery. Everybody responds differently. I'm totally fine around the blood. My sister, she sees blood, she's ready to faint. So keep all of that into consideration. And for yourself as a partner, because you are the partner especially, and because this is somebody you love and care about, it might be emotionally also challenging for you and difficult, because when we see our loved ones in pain and after surgery, there is going to be some minimal pain or discomfort. Um, it's hard. It's hard to see. And a lot of times you will feel like you're helpless, like you're seeing loved one in pain, and yet you can't do anything about it. So also take care of yourself as a caregiver. Make sure you have somebody to call. Make sure you have somebody to talk to. Make sure you do whatever it is you need to do for yourself to be really present, not only for them, but really be present for yourself. So that would be my tips. I wish you all the best. It's amazing to see a partner being supportive. I love seeing that. I think that's great. I like it to you. Good for you. So that would be my recommendation. Also, I don't know which surgery your partner is going to have. So before jumping to conclusion, I would recommend on my website under if your partner, let me phrase it, if your partner is having specifically vaginoplasty, then on my blog, I have under the trans feminine blog, I have preoperative kit that doctors that I talk to that does a lot of vaginoplasties. I feel like I can't speak today form sentences for some reason. So I'm sorry if sometimes that don't make sense. But the doctors that locally here in Los Angeles, Dr. Satterwhite, that performs a lot of vaginoplasties, I talked to him, I interviewed him, and he shared his preoperative toolkit that he recommends for people to be prepared to have on hand as they're going through vaginoplasty. So if that's the procedure your partner is having, I have that on my website. If not, definitely talk to your doctor regardless, and get the idea. And hopefully their doctor will also have a toolkit of what to prepare for. Great question, and thank you so much for being there. I like when people support other people. Next question. Hi, Dr. Z. Do you have any insight on safety and getting your name, gender marker legally changed? Seems like we have a lot of safety. Makes sense, of course, with everything going on, a lot of safety concerns today. I live in the United States and I would like to change my name to my chosen name and change my gender marker to X. I'm afraid of some of the safety issues that may come with that. Would it be harder to get employed if the recruiting officer can see that you had a name change? Would I have trouble flying or with police by having X on my ID card? I'm even more scared as a disabled non-binary person and the increasing anti-trans media. Are these worries a legitimate cause of concern? So, if so, how can I reduce the risk of financial or physical harm by undergoing changes to my documents? Thank you in advance. It breaks my heart to see that all of you are concerned with safety. It's very fucked up. It's very fucked up that this is even an issue. Let me answer your question. Is this a legitimate concern? Yes or no? It's a legitimate concern depending on where you actually live in the United States. There are definitely states where people are prejudiced. There are definitely states where having an X on your ID may put you in a challenging situation. I'm not going to say that job recruiters who are all objective and non-biased. That's bullshit. Of course, people are biased. So it really depends. If you live in a more liberal state, California, New York City, for example, just to name a few, I say that it's a less of concern. And in that case, I say it's valid for you to change it, especially since it's something that obviously not only means to you, but this is who you are. It's a reflection of who you are. But it's hard to say whether exactly it's going to make your life more challenging or less challenging. I want everybody to be a little bit more careful because these times are so difficult for so many of you. Is that because it's so close to your personal issues, it's going to be inevitable that a lot of you are going to be immediately feeling that the dangers that you feel applies to everything in your lives. And that just going to make you more anxious and breed even more depression and make it very hard for all of you to exist and to live and to carry on with your lives. So ask yourself, where do you live? Ask yourself whether you live in a place that is more liberal. I also hate safety to be a caution, kind of a stop sign for you, because what are you supposed to do? Just stop existing, stop being who you are? That's also not an answer. So it's a challenging one. I don't know what to say without knowing the state you live in. Yeah, it's a really hard one. I'd say again, consider where you're at and go by that. If you in a place where it's not safe, is it possible for you to wait? Is it possible for you to, in other words, how much effect is it going to have your old ID card until things feel a little bit more safer? That's also something to consider if safety is a concern. But yeah, this is a huge question. Feel free to comment below to clarify what state you live in, and I would love to give you my additional input. I'd love anybody else to see what state you live in so that others can also, if they're from that state, can share what their experience have been. I think with these times and the challenges that they present, there's going to be a lot of things that are going to be unanswered. I think for a lot of you, there's not going to be an answer. It's unfortunately that's the way it is. I wish you all the best. Question number 5. Hi, Dr. Z. Thank you for providing invaluable information. You are very welcome. Recent disturbing legislation, like I said, It's amazing. I picked questions randomly. I was just thinking about making a video for all of you how to survive these times, and it's like on all of our minds, isn't it? Recent disturbing legislation against trans people varying in intensity from state to state is undoubtedly impacting us in very bad way. Yes, it is. What are your thoughts and advice? Thank you. Um, I'm gonna say what I probably would have said if I made a video about this, and maybe I will still make a video about this. Uh, Listen, you're all real, obviously, and you're not delusional. You're not loony. You're not making this up. You are real human beings. You're real people dealing with a real phenomenon that happens to revolve around gender incongruency. I see you, and while I don't know exactly what it's like to live with gender incongruency, I understand a lot of you probably, I can probably honestly say more than a lot of other people because now getting close to 2 decades, my energies have been so embedded in all of your lives one way or another. And um, what I really wanted to say to all of you is that I know I may not know each one of you. You and I may only have interacted in a comment section. Maybe I answered your comment. Maybe I put a little heart by your comment and said, thank you for sharing. Maybe you emailed me. Maybe I answered one of your questions in Q&A. Maybe that's the only extent of our interaction. And while I don't really know all of you in so many ways, I know you more than you realize. Because I know to such depths and extent what all of you are struggling with. And by knowing all of you and what you're struggling with, I also know how fucking resilient all of you are. And I also know the power that all of you have when you all get together. During this unprecedented, horrific times, are exact times to draw in closer to each other, to lean on each other, to support each other versus finding differences even within transgender community. And I see so many differences within the transgender community that people constantly fight over. From you're not a real trans. If you don't have childhood memories, you're not real trans. If you're not going through all the surgeries, you name it. I hear it constantly. The bottom line is all of you are human beings. We're talking about people here. And all of you are going through exact the same pain and suffering. It's just different on an individual basis. So we need to lean on each other. This is what I recommend. I'm so grateful all of you supporting this channel, because in supporting this channel, it's also the channel is also supporting you. Go look at other content creators who put out supportive, encouraging content that helps elevate all of you up versus destroying you down. Join their platforms, because the more people join all of the social platforms, the more people can find those platforms. It allows all of us to gather together. During this time, it's imperative for all of you to take care of yourself. Self-care is going to be huge. And I'm not talking about going shopping or getting your nails done or taking a hot bath. That's fucking given. All of that's not self-care. That's you doing something nice for yourself. Self-care is trying to really decompress. Meditation, taking deep breaths, going for walks where you can really ground yourself. And yes, that means sometimes sitting down and just having a cry and just letting it out of yourself. I can't tell you how many times I have cried when I have come on TikTok somebody sharing something, and it's like it strikes my heart because I mean I'm getting emotional right now talking about it because people are so fucking cruel and they don't have to be. And I can't even imagine what it's like for all of you when people are cruel toward you. So if you need to let it out, let it out. It's okay. Cry it out. Let it out, my sister. My mom always say, have a good cry. The next day, wake up. But you all are, you know, I want to say fighters, and I know a lot of you hate to be called fighters. Dysphoria took away your peace of mind. And being a person struggling with dysphoria also elevated you to being able to handle way more shit than anybody else. It doesn't justify that what's happening to you right now is unfair. And it's not about you being so strong that you should be able to handle this. No. I'm just trying to point out to all of you that your capacity for being unbreakable is something that I witnessed as a psychologist. And perhaps it's because a lot of you have been struggling with this shit since you were children. So you learned how to be unbreakable to the point where you just cannot be broken. Keep that in mind. Remind yourself that you're actually stronger than you realize and you think. This is what I recommend. Stick together. Take care of yourself. And wake up, put one foot in front of another, and do the best you can. And know that there are people there that care deeply about you, even though you may never see them, never hear them. I'm one of them. If I am one of them, imagine how many people like me are out there. My husband is one of them. You never seen my husband. My mom is one of them. So I don't know what else to say because, I feel like um it's almost feels like shallow advice to all of you because again, I'm so privileged to not deal with gender issues and take my gender for granted every day. So I can't even fathom what a lot of you are going through. But all I can say is I'm here for you. Um, Use the platform. Sometimes a lot of you will comment and you'll say, "Oh, I'm ranting." Rant. Yes, rant. I love your rants. I read your rants. This is what it's for. Um, there's something very therapeutic about this interaction, even though I'm not any of you therapists. There is still something helpful about being able to have somebody hear you and say, yeah, I hear you. This is hard. This is really difficult right now. So use this platform, share among each other, support each other. Um, if you don't want to share on platform, you want to be private, email me. You can vent to me. Some of you do. Some of you will email me you long stories, you long lives. Please do. That's what I'm here for. I'm here to support all of you. So let's support each other and let's stick together. This is my advice. Last question for today. And hopefully we won't have any emotional breakdowns. I'm 34-year-old transgender woman from the Boston area, and I'm relatively new fan of yours. I love what you do and wish I'd found your channel early because you talk about a lot of topics that would have greatly reduced my struggle during the early stages of transition. Well, I'm glad you found it now. I'm a skateboarder, and recently one of my friends encouraged me to enter into a contest for women's skateboarding. Well, I feel that after 7+ years of hormones, my body's abilities are not much different than a cis woman. I still feel like it would be wrong for me to enter, even with my cis female skater friends' encouragement and support. So my question is, do you think that trans women have an advantage in sports? Or am I just doubting myself because of all stereotypes and controversy surrounding trans women in sports? Thank you for all you do. Uh, um, I'm trying to think how to answer your question because, okay, I'm just going to be transparent with all of you. I don't really know where I stand on sports. I'll tell you why. Part of me fully recognizes that, especially after people go through 7+ years of hormone therapy, uh, your body is not going to be as strong as it is going to be for. Actually, as I'm talking about, I think I know where I stand on the sports issues. I don't think I just ever thought it through. What I was going to say is your body is going to be not as strong as it would have been if testosterone was raging through your veins. Uh, on the other hand, I heard some people bring up arguments that I thought was interesting in a sense of, on a surface, it sounded reasonable to me, but now that I think out loud, I have a counter argument to that. The argument was, yes, even though your body is weakened by only having estrogen in it, all of the other changes that your body experiences as a result of going through the male puberty is still present and therefore puts other women at disadvantage, such as maybe longer, taller height, um, I don't know, bigger lung capacity, whatever other changes people bring up. But now that I think about it, um, I think you absolutely have a space in women's sports, and I think it shouldn't really matter. I'll tell you why. We as humans are so prone to divide the spaces in order to exclude trans people. But nobody wants to talk about how in cis sport categories, right, like cis male and cis female categories, how there's already people in there who are going to have an advantage because of their genetics, an advantage because some men are going to be taller, some women are going to be taller, an advantage because somebody is going to have particular lung capacity. So sport is already, in my opinion, a field of disadvantage. There's no way to have an equal advantage. It's impossible because not only does everybody has a different genetic predispositions that either propel them forward in terms of their particular sport or created even more obstacle. On top of that, depending what country you come from and what access to training facilities and training resources you had, also going to put you at disadvantage, right? So if you thinking about college football, my husband is a big college football fan. He got me addicted to college football fan. I'm from Oregon, so I got addicted when Chip Kelly was doing for Oregon Ducks. If anybody are college football fans, and you should have seen me. I mean, I was probably the biggest fan. Point that I'm trying to make. Phil Knight, creator of Nike, funds the Ducks, the Oregon football team. And he funds it to such extent that there is a sports facility that is fucking remarkable to create an amazing environment for these athletes to train in. Now imagine college athletes competing against Oregon Ducks who never had access to such environment. Now we're talking a disadvantage again. In sports, as we actually talk about it and vocalize it, there's no fucking advantage. There's no such thing. We want to believe there's advantage, right? Because then, it makes the game more interesting because look, everybody has right advantage. They're all trained in their sport and they're all going to compete against each other. And let's just see who's going to win. This is interesting. But the reality is, no. The advantage is going to be very, very different. And it's going to be disproportionately scattered. Having said that, yeah, go ahead and join the team. Unless it really makes you uncomfortable and you yourself feel like you have a conflict. Because we all have conflicts, right? I had conflict about this issue until I started talking about it. Now as I'm talking about it, my conflict is resolved. I'm like, yeah, fuck yeah. It's a disadvantage already. Go for it. For you, you may have a different conflict. And if you have a conflict, it may be making you feel like you are deceiving or making you feel any other types of sort of stuff. And then it might go against you in graded values as a person and will make it difficult for you to compete. Plus, I don't want you to compete and feel anxious about who you are. So figure out whether you just want to own and, I don't know, come out to the team and go for it, or you don't even have to come out. It's your personal thing. Join the team and go for it. Either way, I think that do you have a advantage over the room? Who knows? I don't know. Maybe, maybe not. I mean, think about it. Not every trans person that participates in sports are winning. They're only going after the very small, exceptional individuals, and they're exceptional regardless. So, I bet there's probably women on the team who have way bigger advantage than you do, and you don't even realize it. So, having said that, go enjoy, have fun, and what is it? Skateboarding and skateboard, and be careful and don't hurt yourself. I'm smiling because, my God, just think about it. How much goes into um, how much have gone into this discussion about sports, and uh, I yeah, but as I think about it, it's all a disadvantage from the get-go. There's no such thing as advantage, so forget about it. Makes me think of the movie Gladiator with Russell Crowe. You all watched? Have anybody watched that movie? Where they are put in that arena to fight again, disadvantage. He had tremendous advantage because of his past life and his past physical training, and the other people had tremendous disadvantage. Early beginning of sports, complete disadvantage. So there you go. So comment below, let me know, share your thoughts about sports. And if you don't disagree, if you think that trans people are putting others at big disadvantage, share why. What are your thoughts on it? Please, but be mindful how you share. I always up for critical discussions. But comment below if you have any questions, leave your questions, and otherwise, make sure you all support each other and make sure you all stick together and make sure we're all here for each other. Again, especially during this time. So as you can see during this Q&A, a lot of people are fearful, a lot of people are worried, a lot of people are uncertain and uncomfortable to even be out there in the world living their life. So it's more than ever important for all of us to stick together. So let's do that for each other, and I will see you all next time. Bye.